technologies that is used in diagnosis, treatment of disease and injury. This information is also used in research evaluation and continuing education for healthcare professionals. Whereas traditional inpatient healthcare services, this is where there is face-to-face interaction between the patient and the provider. I want us to note one word in our motion, which is alternative. When one says they have an alternative plan, it is that plan that they use in a case where they cannot use another. In this case, we are not saying that telemedicine is here to replace traditional inpatient healthcare services, but it is that plan that we are going to be using in a case where we cannot access another. In this case, traditional in-person healthcare services. I'm going to talk about how telemedicine brings about accessibility. I'm also going to talk about cost effectiveness as well as the quality of healthcare that telemedicine comes with. Going to my argument, accessibility. When we talk about accessibility, you and I are coming from a place where people have to walk 5 to 10 kilometers just to access healthcare services. Not only that, people have to travel about 15 hours for 24 hours, others even more than that, just to access a tertiary healthcare service where there are specialists. When we look at the statistics that the World Health Organization has done, about 30 to 40% people in Africa are the only ones that are able to get these services. And looking at the numbers, we know for a fact that traditional healthcare services that we have been using have not changed these matters. And this is why with telemedicine, it has platforms that are called as consultation centers. We also have specialty centers. With these centers, they will act as secondary sites where patients in rural areas can go, log in their symptoms and their information, which then the information is transferred to physicians that are very far from them in order for them to access the services. You agree with me that this is a game changer in that people will not have to walk the 5 to 10 kilometers just to access healthcare services. People will not have to travel for 2 days, 3 days just to access the specialists that are very far from them. Talking of telemedicine and still on accessibility, when we talk of mHealth, which is mobile health, globally, we have 6.6 billion people that are using mobile phones. And in these mobile phones, we have platforms that are being used. And these platforms are going to enhance the accessibility of healthcare services. A study was done in my country by the Ministry of Health, where it was discovered that telemedicine has improved the accessibility of specialists by 50%. And I believe telemedicine is a viable alternative. Going to my second argument, which is cost effectiveness. In our African setup, we have an Abuja Declaration which states that every African country has to commit 15% of their national budget to the healthcare sector. But it has been documented that not all African
Time up. Can you guys hear me?
Yes, so that's time up.
Yes.
All right. Thank you so much, University of Zambia, for your first 5 minutes introduction. Thank you so much for the point stated. So we'll move to the University of Rwanda for your 5 minutes of your introduction. You have 5 minutes and you'll be muted once it's 5 minutes.
Thank you so much. Personal care practice has existed since ancient civilization. Egyptians, Greek, and Romans has elaborated routines for hygiene and beauty using oil perfumes and other forms of skincare. Here, going to our argument today, telemedicine is a viable is a viable alternative to traditional in-person healthcare in Africa. We are opposing side from Rwanda. As we proceed, I can say that in-person healthcare in Africa, it occupies more space than telemedicine. In Africa, 16% of Africans are working on non-reliable internet technologies. That is why the telemedicine is very hard in Rwanda overall in Africa. Second one, telemedicine it cannot process an emergency situation. For example, how can you just make an accurate diagnosis for someone with a malnourished or someone who need care for abdominal pain? Second argument. Third one, in-person visit enable healthcare providers to conduct full physical examination, which are essential for accurate diagnosis and treatment plan. Many medical procedures and treatment requires a physical presence, such as surgeries, wound care, and physical therapy, which cannot be effective conducted through telemedicine. Many rural and remote areas in Africa has limited access to reliable internet, electricity, and advanced technology required for effective telemedicine. I said that 16% of Africans are working on low internet access. In-person care allows for a personal connection between patients and healthcare providers, which can be crucial for providing trust and ensuring effective communication, especially in regions where cultural norms are important. How can you just use and breed a trust and the connection with a patient without meeting face to face? It is very hard. And how can you just do a complex assessment, a comprehensive examination with just, we know that physical examination comprises 4 main steps: inspection, palpation, percussion, and auscultation. In the abdominal palpation, we know that when we are palpating abdomen, we have to use our hands on. How can you just do it with a telemedicine arguments? From proposing side from University of Zambia, she told us that 40% of Africans live low. 14% of Africans use telemedicine. Means 16% of Africans don't use telemedicine. Means they use in-person care. Look all over around. You see that there is many hospitals. You see that there is many health centers, and even more. How can you just conclude that telemedicine is a viable alternative than traditional in-person? Thank you so much. I'll close my case.
All right, thank you so much. You closed on a case that needs an answer. So we'll move to the next stage, which is 2 minutes of University of Zambia to counter your argument. So University of Zambia, please, the point she has raised, please counter that in 2 minutes. Thank you.
Thank you so much for the presentation and for raising some of the quite factors that are on the ground. And I would like to rebut, starting with what you mentioned concerning the physical examination and some of the face-to-face interaction between a doctor and a patient. And we know that quite right, yes, in the clinical practice, there is need of physical interaction with the patient. However, with telemedicine, you can cut on some of the burden on the doctors, where you can attend to patients, to those who come with non-emergency consultation. Some of these practices under telemedicine, there is what is known as teledoctor Zambia. Like here in Zambia, we have teledoctor app, which creates the interaction between the patient and the doctor is recorded. And with that, The doctor can therefore refer the patient to go and visit the nearest hospital or clinic where physical interaction, physical examination is required. For some of the consultations that can be done with telemedicine online are things that include dermatological problems, of which we know that nowadays everyone wants to look nice. Someone doesn't need to use Uncle Google for them to know some of the remedies. Instead, they can simply book consultation and then they get the required medical services that they need. And for things that require surgery, of course, the burden will still be reduced because now the booking can be done. The doctors will be able to attend to the patient and refer the patient, oh, you can come to this hospital, this clinic, this time of the day, and try to just simply come for that particular operation that is needed. And some of the things that she mentioned, talking about remote areas not having internet, this is the modern world technological century where we've seen an increased investment among most African countries where they're investing in technology. And one of those things is increase in service providers, of which we know that almost near
Time out.
University of Zambia.
Hello, time up. What's going on?
University of Rwanda, you have 2 minutes to counter what has been said by the University of Zambia.
Yeah, thank you so much again. He was introducing that there is many doctors that can help while with using telemedicine. The WHO framework on integrated pupil-centered health services in 2016 underscored that the importance of trust and the personal connection between patients and healthcare providers as a crucial component of effective healthcare delivery. So I can just, all of you can just wondering yourself, how can you build a trust? We know that there is a cultural language barriers that are overlapped. How can someone from Lulu area, for example, elder or very child children, how can she or he attend and get into insight with the telemedicine with those language barriers or culture barriers? It is a crucial problem to deal with because there is still a culture and language barriers that are all around in Africa. And also building trust makes a compatible problem because it takes a time to build a trust and the connection between patients and healthcare providers. Thank you.
All right, up to time. Thank you so much, Sophia. So we have the last round now, which is 3 minutes to conclude on your argument. So this time around, you have just 3 minutes to share your strongest point, right? Just share your strongest point, summarize your argument, and close your case. Over to University of Zambia.
Thank you so much once more. And I wish to write on the protocols already observed and the motion that is already on the table as stated by my first speaker. And going forth to the points that I have prepared for this evening, I would like to write on there is one thing that we should take into consideration: efficiency and convenience of telemedicine when it comes to providing services to the patient. What I mean by this is that telemedicine often allows for more flexible scheduling, reducing wait times. For example, patients can book a same-day appointment with a healthcare provider online rather than waiting for weeks for an in-person visit. And for most specialized doctors, where we know that they may only show up at a particular clinic or hospital on particular days, instead of a patient going on Monday, Tuesday to just find out which day the doctor shows up at a particular clinic, they can instead book a specific day so that they don't get to have those inconveniences. And telemedicine also provides a 24/7 availability of services. Another thing we need to understand is that there is enhanced monitoring and follow-up. What I mean is this: with telemedicine, for example, here in Southern Africa, we have what is known as teledoctor app. And this teledoctor app, because we understand the doctor and patient relation, there is supervision and surveillance by the Health Profession Council of Zambia. What it means is that the practices of telemedicine is not just done at the convenience of the doctor with the patient, but the regulations and all the rights of the particular patient are followed, meaning there is regulation and surveillance for these services that are done online. And with that, there is need to understand that this enhanced monitoring and follow-up allows for continued monitoring of chronic conditions. For example, a diabetic patient can regularly send their blood sugar readings for their doctor for timely adjustments for their treatment plan. For that, even for patients who have undergone surgery, meaning for surgical care, patients can have better follow-up after surgery, reducing the need for frequent hospital visits and minimizing the risk of complications. Also, telemedicine here has played a role in the coming of COVID-19 in 2020, where we've seen that it was able to, regardless of the social distancing that came in, patients were able to be given services through the telemedicine. And telemedicine, we must understand that it does not just mean that patients can't be seen physically. It does not mean that patients cannot be seen through the doctors. We must understand that telemedicine encompasses all the services such as smart care, where the digital documentation of the patient's details, the digital health. It also encompasses factors that contribute to research, and also in which in this modern world, we understand that there is also provision of where we should be able to predict the next coming of a pandemic rather than being caught unaware like what happened in 2020. And also we need to understand.
Time up.
Thank you so much for your concluded session. Over to the University of Rwanda for your concluded session. 3 minutes, please. Thank you.
Thank you. Thank you for the participation. So after hearing about the points of the University of Zambia, and as of course the conclusion of this debate, I would like to tell the University of Zambia that why telemedicine has the potential to increase the healthcare delivery in Africa. I can tell her that it's not yet visible. It's not yet an alternative to traditional in-person care, especially in Africa, because we have different problems. Firstly, a problem of access to technology and internet, where we know that most of the population in Africa don't have access to reliable technology that they can use. In the consultation with doctors, making them telemedicine not viable in Africa. And the second point that which make telemedicine not viable in Africa, it's because like they have said before, in-person care offers the physical examinations and personal interaction, which is very crucial and critical for the accurate diagnosis and effective treatment. So telemedicine cannot replicate those in-person physical examination, because it's online. So with that being said, I strongly oppose the point which say that telemedicine is better than in-person care, especially in Africa. Thank you.
Awesome. Thank you so much for sticking to time and for clearly, standing by your points that telemedicine is not a viable alternative to in-person care in Africa. So we've come to the end of the debate session. While our judges are collating their points and putting together the scores, I would like to open the floor for our participants to ask our debaters questions. Maybe during the course of their arguments, some questions begin to come up, so you can unmute or you can raise your hands to ask them. You can direct your questions to each of the speakers who have spoken. So do we have any questions for our debaters? while we await discourse from the judges? Or do you have any comments on what they've said so far, or an opinion or questions you'd like to ask them? Okay.
Good.
All right. Good evening. Go ahead.
Yeah. So my name is Deborah. Okay, Doing, and I'm one of the judges. And then my comments that would have the comment I just want to say is the University of Rwanda had I mean they had some point that they could actually use to tackle some of the points of University of Zambia. I mean, in-person traditional care. So, but then the telemedicine also, what I actually was expecting from University of Zambia was because they made the University of Rwanda made mention of telemedicine might not be able to take care of emergency cases and everything like that. But then there are actually some advice, because there are some emergency cases that even before it gets to the hospital or to the nearest clinic, the patient is already dead because there is no telemedicine that they can actually use to contact with a doctor or with a like an emergency unit, that even a person that is beside the person that is in an emergency can actually do before there is a medical care, before a medical care comes in. Like in the case of somebody choking, there are some there are some techniques that you can actually use for they call them maybe first aid trainings. There are some techniques that can be done and the person will be okay, but before you get to the nearest clinic, the person had already died. So those are some of the points that I was actually expecting, but then that is my comment. Thank you. They all did well.
All right. Thank you so much. Do we have any other comments for our speakers? I saw someone raise their hands earlier on. Okay, I think comment from my end would be number one, please always ensure you have good internet connectivity so that we can hear you clearly, so that we don't miss out any point, and your opponent or whoever you are arguing against can hear you clearly, so they know what to really counter. So I think for subsequent ones, try to check your internet connectivity and maybe try to stay in a location that is not noisy, so we can all hear you clearly. It's part of what you add to your score, because if we can't hear you, they will not know which argument or which point you are making. So let's take Bright. Hi, Bright.
Hi, good afternoon, good evening. Thank you so much for the opportunity. And I think it was very productive conversation, hearing both the team from the University of Zambia and the Rwanda University. I think both teams brought their A game, but I think a few things that I noted during the conversation is I like how prepared the teams came. They were ready to bring this conversation. But I think one of the things that could have really been helpful for both teams is if we could reference data from on a large scale. Like we have articles by WHO, we have the World Bank release articles and data with regards to, for example, the team that was proposing that telemedicine is an alternative. There's a recent publication by World Health Organization regarding telemedicine. I was expecting to hear those numbers from this conversation. Then the team that was opposing, I think part of the conversation they're talking about how much the internet is able to penetrate in Africa. I think ESCOM has published a number of articles and things telling us about device penetration, about internet connectivity. And also we have things like satellite network now where we're able to do telemedicine. So I think quite a great conversation, but also I think the time wasn't sufficient. I'm not sure. I felt like we could have had more time for the speakers to give us the juice so that we really get to enjoy the conversation. I think this goes to just a comment to the organizers of the debate. So, but I think that both the teams came in with great game, but we needed more numbers, more facts, and also I think I know the teams were referencing things that are done locally. I think for a platform like this, it would be very important to reference things that are more global, not just what happens in your country. Tell us about things that are happening on a global scale, things that everyone could relate with. I think that was very also something that I thought could have come out more strongly from the teams debating. But my opinion about things, I think, as a practicing medical doctor, I think telemedicine has its place. There are things that we benefit from. For example, in emergencies, by the time the patient comes, the first thing you want to do is investigate. So by the time the patient is coming, there are the things that they could do as they are coming to sustain the patient. And for patients that come in not emergencies, telemedicine definitely has a very, very huge role to play for decongestion of hospitals. Too many things to say, but thank you so much. I'm looking forward to hearing the way forward for the conversation.
All right. Thank you so much, Bright, for the comment. And yes, so I share your sentiments about data. Please, let's be data driven and give us evidence of these things by giving us the statistics and data. I think University of Rwanda gave a bit of data when they spoke, they referenced WHO and the likes. But we can have more and data, more comment. Still waiting for our judges to send in the final scores. Do we have more comments? So the essence of us having this debate is to, okay, yeah, go ahead.
All right, good evening. So welcome
Good
and thanks
evening.
everybody. Okay, I'm Nuruddin Absalom from Nigeria, so one of the judges. So what I would love to say is the fact that one, I realized that for both things, the University of Rwanda kept on mentioning something that is crucial, and that is the issue of trust. Why? For the University of Zambia, they based their argument on accessibility. So during the rebuttal section, I wanted to, or I was hoping to hear that the other team will try to defend themselves that yes, the issue of trust can be established, even though it occurs online because we are using other platforms online. And for the issue of accessibility, so University of Rwanda actually did that, but I would advise that they also work on their delivery. So on their delivery, both the confidence, the how audible they are, and the stuff like that. So majorly, so just to wrap it, I would say, as we all know, so technology is to augment our process, not actually to replace or remove. So we can actually do a lot and better when we can get things done easier with technology. Thank you.
All right, thank you so much, Nuruddin. So our scores are coming in. Okay, so I have the scores now. And so, but just before I share the score, from my end, I think in Africa, of course, we have the challenges that the debaters have mentioned. Telemedicine is a promising solution. It's working, honestly, but then we have challenges that is not making it scalable at the moment, which are the things that have been argued, which is the infrastructure, cultural nuances, internet penetration, mobile phone penetration, and the likes. So I think for me, a hybrid model that combines telemedicine with traditional in-person care would actually offer us the most effective approach. We cannot totally scrap in-person care, and we cannot totally depend on telemedicine. It's going to be an hybrid model, right? So, for example, while I was in Kenya, I had a medical issue, and I was able to consult on my phone. And I was able to consult on a phone with a doctor, but then I had to do an ultrasound. So I have to go in person. So it's going to be hybrid, right? I don't think there will be a point where we'd totally just do telemedicine, or a point where we'd leave telemedicine out and totally do in person. It's going to be an hybrid, and they both have their pros and cons. And I think by embracing the hybrid model, it's going to help us maximize the potentials of both models. So that's my perspective to the discussions. But it was a great conversation. We've learned a lot, and now would announce the winner of today's debate round. They will be moving to the next round in the debate series. So based on our judges, based on your content, your delivery, your organization, clarity of points, and your defense, and confidence in which you've been able to deliver your points. I would share my screen now and would have the winner of today's debate. Just give me a minute. Okay. Can you see my screen? This is still loading.
Yes, we can.
All right, so let's roll the drum in the comment section for our winner of the Digital Health Student Debate Series Round 2. Our winner is the University of Zambia Campus Network, leading with 69% of the score. And you were judged based on your content, your evidence, your delivery, persuasion, organization and clarity, rebuttal, and defense. And so congratulations to the University of Zambia for winning this round. So you are proceeding to the next round and would announce the next round of the debate session, which will be coming maybe before the end of the month. We'll have another session. And we'll keep doing this to the end of the year, where we'd now have a final debate round and pick our winner of the 2024 Digital Health Student Debate Series. So please keep in touch. We'll keep doing this, I think twice a month or once every month, but you get to see notifications on our social media platforms on the next round and the next school. We will be facing each other. If you have topics you want us to debate about, please share with us interesting topics you like students, young people to argue on and share their critical thinking and perspective on. Please share with us. If your school is interested, reach out to us. We'll give you a slot. Thank you so much, everyone. We really apologize for starting really late, and we hope not to do that again. But thank you for staying with us till we're able to actually start this debate round. Let's keep in touch and let's keep, thinking about critical issues like this in Africa, and talking about it, discussing it, and creating awareness about the technological advancements in our healthcare system. See you again next time. Bye.
Bye.